To diagnose Alzheimer's we need a good history and physical examination. We needs MMSE mini mental status examination. SLUMS St. Louis mental status exam, MOC AMOCA Montreal cognitive assessment. Then some laboratory exams including CBC-CMP, chemistry PAL, TSH, B12, folate, serum calcium mainly in multiple myeloma, breast, prostate cancer. Urine drug screen and urinalysis. CT head. MRI of the brain. Depression scale. Some other tests such as CSF, analysis, cell counts, RO infection, A-beta 42, tau, phospho-tau, amyloid, special tubes are needed. VDRL serum rapid plasma reagent. Serum HIV, high risk. Genetic testing, not recommended at this time, needs counseling and done in research centers. FDG PET, functional brain imaging, FDG2-deoxy-218F fluoro, amyloid PET, florbetapir, florbetaben, or flutemetamol. Neurotransmitter brain imaging, ioflupainspect. Neuropsych testing. Biomarkers are indicators of what's happening in the brain. Biomarkers can be found in any tissues. Some can even be measured digitally. Biomarkers can help diagnosis to treatment and in between. Alzheimer's disease or another form of dementia was diagnosed through autopsy prior to year 2000, but now biomarkers are available to diagnose dementia in a living person. When combined with history, evaluation and multiple other tests, these biomarkers can help doctors determine whether a person might have or be at risk of developing Alzheimer's or a related dementia. No single test alone can diagnose dementia. Biomarkers completes assessment. In some cases, some of the biomarker tests are only available through a specialty or research facility. Check your insurance plan to find out what's covered. Doctors also use brain scans to find evidence of other sources of damage, such as tumors or stroke, that may aid in diagnosis. Brain scans used to help diagnose dementia include CT, MRI, and PET scans. Similar to CT scans, MRIs can show whether areas of the brain have atrophied, shrunk. Repeat scans can show how a person's brain changes over time. Evidence of shrinkage may support a diagnosis of Alzheimer's or another neurodegenerative dementia but cannot indicate a specific diagnosis. MRI also provides a detailed picture of brain blood vessels. PET uses small amounts of a radioactive substance, called a tracer, to measure specific activities such as energy use or a specific molecule in different brain regions. PET scans take pictures of the brain, revealing regions of normal and abnormal chemical activity. There are several types of PET scans that can help doctors diagnose dementia. Proteins and other substances made by brain cells can be detected in CSF. Measuring changes in the levels of these substances can help diagnose neurological problems. The most widely used CSF biomarkers for Alzheimer's disease measure beta-amyloid 42, the major component of amyloid plaques in the brain, tau, and phospho-tau, major components of tau tangles in the brain, which are another hallmark of Alzheimer's. In clinical practice, CSF biomarkers may be used to help diagnose Alzheimer's or other types of dementia. In research, CSF biomarkers are valuable tools for early detection of a neurodegenerative disease and to assess the impact of experimental medications. In research, CSF biomarkers are valuable tools for early detection of a neurodegenerative disease and to assess the impact of experimental medications. Proteins that originate in the brain may be measured with sensitive blood tests. Levels of these proteins may change because of Alzheimer's, a stroke, or other brain disorders. These blood biomarkers have historically been less accurate than CSF biomarkers for identifying Alzheimer's and related dementias. However, thanks to more research advances, improved methods to measure these brain-derived proteins are now available. This is part 1. Watch for PRT2. Share with others. Share with your doctors so they can do some of these tests if your loved one having problems. Do it as early as possible.